To access texting or nicotine medication, you first need to learn about their risks and benefits and agree to their use in a treatment substudy that is part of the BREATHE2 clinic outreach study. You also need to learn more about who will gather information from you and how that information will be used before you decide if you want to be in this treatment study. If you consent to being in the treatment study, you will then provide some information to help you register for the texting program, or some health information to make sure you are medically able to use medications. Here are some key things to know about texting and medication treatments in this study. The study treatment differs from your usual medical care. Study treatment will be delivered by researchers or by the smokefree.gov texting program, not your usual providers at Aurora Health or UW Health. All treatment you request will be noted in your electronic medical record at Aurora Health or UW Health by your tobacco care manager. Taking part in this study treatment is voluntary. This means that you decide if you want to use study treatment or share your information. Information about the medication and texting treatments you choose will be mailed to you, along with a packet that reviews key information about the treatment. If you get sick or hurt during this study, please get the help you need right away. Costs for any medical care will be billed to you or your insurance, just like any other medical costs. No other compensation, such as lost wages or damages, is usually available. You can stop study treatment at any time. Your choice will not affect your relationships with Aurora Health, UW Health, UW-Madison, any affiliated organizations, or any services you receive from them. No matter what decision you make, and even if your decision changes, there will be no penalty to you. You will not lose medical care or any legal rights. By agreeing to use study treatment, you are not giving up any legal rights. You keep your legal rights to seek payment for care required because of a sickness or injury resulting from this study. Here are some key details about who will have information about you and how they will use it. If you consent to a texting program or to receiving nicotine medication from the University of Wisconsin-Madison researchers, they will need to have access to your name, address, answers to the screening questions, and your treatment request so they can mail you treatment information and medications. If you consent, tobacco care managers will share your answers to treatment screening questions with the research team so they can fulfill your requests and make sure you receive information about the treatments you choose. These data will be stored in a research database that only tobacco care managers and authorized research team members can access. The research team follows strict rules to protect your information from unauthorized use and disclosure, but there is still a risk that your information could become known to someone not involved in this study. The research team also has a certificate of confidentiality from the National Institutes of Health that prohibits them from disclosing information that may identify you in a legal proceeding or in response to a legal request without your consent. They cannot promise complete confidentiality, however. Federal or state laws may permit or require them to show information to university or government officials responsible for monitoring this study, the Food and Drug Administration, that regulates nicotine medication, and to the National Cancer Institute, which is funding the study. If you withdraw from the study, data we have already collected from you will stay in the study database, but we will not collect any more information from you. If you withdraw, we will ask if you want any more information about your routine medical care collected after you withdraw. You have now heard the whole consent. If you want to proceed and you want to do this by phone, call your tobacco care manager at Aurora 414-219-4801, at UW Health 608-265-4561.